So I'm going to be talking about ischemic heart disease, and there are several kinds of ischemic heart disease. The first one I'm going to be talking about is a stable angina. Then I'll talk about a stable angina or unstable angina and kind of move forward there. But first of all, ischemic heart disease. Ischemic heart disease is essentially where you have, blood is flowing into your heart, but you have an atherosclerotic plaque, which is usually the cause of this damage. So here, let's say here's the blood vessel, going into your heart or whatever, and it is there's this obstruction here, which would be greater than 70% of the flow of blood. So it's like a stenosis, preventing 70% of the blood from going in, and that is going to then cause the muscles here, particularly the muscle or the tissue, particularly in the subendocardial region. So if you have epicardium on the outside here, and then underneath you have the myocardium, and then under the myocardium you have the endocardium, which is kind of what comes in contact with the blood on the inside. It's going to be just underneath the endocardium there, so or above the endocardium, however you want to look at it. So with a stable angina, there is no pain at rest. So when, I'll put it this way, when you start exercising, your heart starts beating faster and it requires more oxygen. It requires more blood to supply that oxygen. And so when you are at rest with a stable angina, however you want to word it, your heart is fine. So it has enough oxygen. The tissues are okay. But when you start to exercise and it starts to get those higher requirements, it can't quite meet those requirements, and so temporarily the tissues in your heart become ischemic, which means they're not getting enough oxygen. They're suffering from ischemia. And in the case of a stable angina, they get damaged, but it's reversible damage. It's, one of the telltale signs of reversible damage is that the cells swell, but they don't fully lyse and break up and everything. So with a stable angina, there's no pain at rest. There isn't pain until you actually start exerting yourself. And what it is that's being damaged, or the injury, is to these myocytes. And remember, those myocytes become swollen when they're injured. But it's reversible injury, which means they're not done for. They're just wounded. And typically, in the case of a stable angina, the chest pain, is usually less than 20 minutes. If it becomes more than 20 minutes, that's when stuff starts dying. It starts becoming not reversible or irreversible. So in the case of a stable angina, typically what's going to happen is the chest pain is going to then radiate. Where is it going to radiate to? It's going to radiate down into your left arm or into your jaw. Okay? And you're also going to get some diaphoresis. Diaphoresis is another way of saying sweating. The person's they're sweating, they've got pain coming down their arm, pain in their jaw, the tissues in their heart are becoming ischemic, lasts less than 20 minutes. They also get shortness of breath. They can't get enough oxygen, whatever, shortness of breath, however you want to word that. So if you were to look on an EKG, you would see an ST segment depression. So if you remember EKG, you have all the different leads. You got lead 1, lead 2, lead 3, AVR, AVL, and AVF, and then you've got lead 1, 2, V1, V2, V3, V4, V5, and V6, all coming from different angles. But if you were to look there, I think it might be V6, V5, V6. I can't remember exactly where you look on this, but if you look on your EKG and you look on the this line here, if you remember the line starts at here. You've got the PR interval, and then you have the basically just remember that there's the ST segment, which is, so here's the Q, R, and then the S, and then you have the ST segment, which is right here. This segment right here, the ST segment, which is kind of like just before the T wave. The ST segment is going to be depressed, so it's going to be lower. It'll look like this. Okay, so it's like depressed ST segment. And that's a sign of subendocardial ischemia. So this is tracking the electrical vectors in the heart of kind of the direction of the electrical energy. And in this case, this tissue here that normally would be having a nice strong signal is ischemic. It's suffering, and so that becomes kind of depressed. And you can relieve it if it's a stable angina. You can relieve this through just resting, which of course decreases the load on the heart, or you can give the person some nitroglycerin, which expands this blood vessel here. We're going back up here again. It would expand this, so now the person has enough room for enough blood to get through, and they're no longer feeling those effects.